So thank you for asking these types of questions. And I want to come at it from one of a perspective of a clinical epidemiologist and health services researcher, but also to do it as a clinician. So when we take the 30,000 foot view within the Veterans Affairs healthcare system, as you mentioned, there's more than 2 million veterans that are actively receiving care within the VA healthcare system for headache. And that's across more than 9 million visits since fiscal year 2008, up until the end of last fiscal year. So we're talking about a large number of veterans with different types of headache disorder, between cluster, migraine, post-traumatic headache. And some of the things that we've been learning from an epidemiologic perspective is that the number of veterans receiving care for various headache disorders within the Veterans Health Administration is increasing over time. We've also been finding that there's higher densities of veterans with headache disorders throughout the Southwest, the Texas Southeast, as well as parts of Michigan. So not only have we been trying to take sort of a big picture view, but we've also wanted to get a sense of, well, what are important comorbidities that when I'm in clinic, I really need to take into account when we are sort of seeing patients and then trying to formulate with them as a partner treatment plans. So some of the other things that we've learned using VA administrative data is that comorbidity and multimorbidity is the rule rather than the exception. So for example, anywhere from 25 to 35% have comorbid anxiety. 30 to 40% also have depression. 35 to 45% have PTSD. More than 90% of all veterans with headache have at least one other non-headache pain condition. So we take all these things into account when we're in clinic in terms of crafting treatment plans. But again, that's the 30,000 foot view. So how do we bring that back to clinic? And one of the other things that we did is that we went around the country back when we could travel, and then we started getting veterans on the phone that have been living with headache disorders to get a strong sense of, well, what has their journey with headache been like, both in the active military, into the Veterans Health Administration, and also to do so in such a way to get a sense of what are the types of treatments that they're interested in, what resonates with their values and preferences, and what they want healthcare providers delivering headache care to know. So some of the strongest themes that have come out of that is really wanting access to innovative treatments. We've seen over the last several years an explosion of new therapeutic modalities. So it's a really fantastic time to be able to have such a breadth of treatments for veterans and active military personnel for headache. Yeah, one of the other things that we learned is that not only do they want access to this treatment, but they want their provider to be more knowledgeable about innovative treatment modalities. And there's also been a strong preference to not taking medications, so non-pharmacologic modalities as well. So we've been able to take those themes and be able to bring them into the individual clinic, that veteran in front of us with their family, and being able to do so in such a way that, again, we could understand the comorbidities, but really importantly, their values and preferences as we describe different therapeutic options for them.